So government officials announced a plan yesterday to start offering COVID booster shots to all vaccinated adults starting in September. Here's what the CDC director had to say about it on the Today Show.
We have seen now evidence that we've been looking at just over the last week or so that has demonstrated that the vaccine is starting to wane in its effectiveness against infection. It's still holding up relatively well against severe disease and hospitalization, but we've also seen that we actually need more protection against the Delta virus. We anticipate that people who got Johnson & Johnson will also need a booster. I want to remind people that we started using Johnson & Johnson more than 2 months after our mRNA vaccine. So we're getting more information. That information is a little bit delayed because we started using it a little bit later.
So meantime, a doctor in Alabama put up a note on his office door announcing he will no longer see patients that are not vaccinated. If patients ask him why, he's telling them COVID is a miserable way to die and he can't watch them die like that. Wow. What do you think, Tori, of this doctor refusing to treat people?
On one hand, I totally get it, because if you don't believe in the shots, why are you believing in the medicine when you get sick to come to the hospital? You're taking up a bed, you're taking up a lifeline to some people. However, doctors take a Hippocratic oath to never harm anyone and to face and treat anyone that is hurt. So I'm on the fence on this because I do think he's going against the basic oath every doctor has to take. And that makes me feel icky, but I totally get why he would say that and why he's in Alabama. It's the lowest vaccinated rate in almost all of the country. So he's dealing with this every day, but I don't know how I like it with the Hippocratic oath.
I think he's just drawing a line in the sand. I think if someone really came to him in desperate need, he would help them out. I think he's trying to make a statement for what he believes in. And I think it's just a generalization for what America is feeling right now. Either you're on this side or you're on that side. And that's what we're coming to. Businesses, corporations, arenas are going to say you're going to need this vaccine card to get in here. Whether you get it fake or you get a real one, you're going to need that to get in here. And we're just going to have to divide the country because we can't all seem to be on the same page.
I don't blame this doctor at all.
Yeah.
And I get nervous with the slippery slope, of course. But nobody ever predicted how horrific COVID can be. I mean, I witnessed it firsthand, still witnessing it firsthand with my brother-in-law, who's going on 8 months now in the hospital. And the FaceTime videos that my sister has had to see personally and then show to me, I can't imagine what these nurses and doctors are going through day in and day out. What is that doing to their mental capacity? So I have empathy for him, and he may need to draw that line in the sand, not only to make some sort of a statement, but to protect his own mental health. Can you imagine the trauma?
I can, Sam, and obviously I see where you guys are coming from, but I'm going to say that this doctor's statement almost got me. He had me halfway. If he said, I cannot treat you if you're unvaccinated because of the Delta variant, and even though I am vaccinated, I am still at risk, my staff is still at risk, now we have a conversation. But he said, I cannot treat you because I cannot watch you do that to yourself. Now, if we had a doctor that said, I'm not going to treat you because you're morbidly obese and I cannot watch you eat, because you're a smoker and I cannot watch your lungs deteriorate,
right,
we're going down a weird path.
Yeah, but COVID's different.
I get it.
It's different though, Al. It's different because with COVID, there's no precedent. With obesity, we have decades and decades and decades worth of research. They know what kind of treatment to do. With COVID, you should have heard the conversations that we had with the nurses and doctors every Thursday when we had our conference group calls. Let me tell you, they don't know what, they of course know what they're doing. Please respect what I'm trying to say. It's new. So this is different than obesity. And I get where you're coming from, but at the same time, I think we're forgetting what the doctors are going through and what the nurses are going through. And they really are on the front lines right now. And who's protecting them?
Yeah. Well, I don't think we forget because I don't think we hear from them, Sam, and I think that would be great if we did. They're human beings.
It's a great idea. I could probably find a few nurses and doctors who treat COVID daily, and they could hopefully one day come on the show and lend their opinion.
It's like war.
Yes.